Let me just begin by acknowledging that I'm coming from Darawal lands down in Wollongong, and I'd like to pay respect to elders past, present and emerging. Um, our topic then, as Brendan has already noted, is the role of informal community supports within the logic or the rubric of the NDIS. And to make sense of that, it really actually helps if I give you a little bit of history. So bear with me as I I guess, set the scene for why Australia has actually largely failed to focus in a way that it should do on informal community supports, but then also the opportunity that comes from that failure. So before the implementation of the NDIS, which began to roll out in our community around 2013, disability services in Australia were largely fragmented, underfunded, and unequally distributed. Just to give you a tiny example, when I first incurred my spinal cord injury in 2010, the amount and quality of long-term equipment and personal support funding that you received depended entirely upon how you happened to incur your injury. So if you go to the third slide there, Brendan, or Max, for those lucky enough, and I use that word lucky advisedly, to be injured on our roads, the green slip system provided a top tier level of support. So regardless, this was a faultless system. So regardless whether you were a victim or a fault on the roads, road user registration fees provided insurance funds that were managed through iCare's Lifetime Care and Support program, which gave people access to top level equipment and high levels of support. iCare, for example, established programs like the Sargood Centre of Rehab Support and just really top quality services. I've got some pictures online there. One's a high quality standing wheelchair, and the other is just a standard power wheelchair. And depending on where you got your roads was, when I went through the injury, was whether you could get access to the top quality machine. So I couldn't, for example, because I didn't incur my injury on the road, get access to the standing chair at that point in time. There was some people, of course, could sue for negligence, so they managed to get their funds in those sort of ways. Although, depending upon the strength of their case, the results proved inconsistent, particularly after governments, at the behest of insurance agencies, capped the damages that people could claim. Most people were funded through the New South Wales government scheme at the time, which was called Enable, which had more limited funding than iCare. And the difference on the ward was palpable in terms of the type of equipment and support you could receive. And then, of course, the other difference in wellbeing depended upon the family and informal supports that you had access to, whether you had family, friends. And so the different level of sort of access and thriving really depended on a bunch of factors. Now, outside, that's just one example. More broadly, people who were born with disability tended to have less access to support than those who incurred their injuries later on in life. Most disability supports were funded differently from state to state and community to community. So there was a real inequity in the system. Most disability supports were block funded, which meant that governments allocated funding in bulk to service providers rather than individuals with disability. And then service providers received funds based on historical spending and general population estimates. And often their services were unfairly distributed. There was long waits for services, and people with disabilities had very limited choices about the services they received. So as a consequence of that, the disability community rallied together in what was to prove to be a really extraordinary collaborative effort of social change. The Every Australian Counts campaign brought together disability persons organisations, people with disability, advocates, service providers in a really unique collaborative effort to bring government change. They produced, for example, the 2009 Shutout Report, which is still a really excellent read about the different ways in which people with disability were shut out from participating at all levels of Australian society. In 2010, the Productivity Commission produced a report recommending a move toward an insurance model of disability, which was to mirror the Green Slip eye care funding support program. And the key emphasis of this new system, you can show the next slide for us there, please, Max, was, I guess there's multiple parts to it, but the idea was to provide lifetime disability investment, which was to begin early in a person's life to improve long-term outcomes and reduce future costs. It was intended to provide individual plans that gave the person with disability choice and control over where to spend their funds. And it was intended to ensure equitable funding across all Australian states, territories, and communities to sort of get rid of that inequity that existed in the previous system. Now, there was many other intentions for the program, and it achieved many of its goals. For many people with disability, the NDIS has proved to be a life-changing scheme, but it hasn't been without its difficulties. And the recent NDIS review, as well as Royal Commissions, I was involved myself, worked for 4 years at the Royal Commission, but they noted several problems with the current system. The first was market failures, particularly in rural and remote areas, and also among certain cohorts of people, such as First Nations people. The system proved to be complex and often bureaucratic. Just recently, I've had a problem with a 10-year-old chair that needed to be replaced, and the NDIS took 4 months to approve it. Meanwhile, my chair completely collapsed and I'm having to use a higher chair. So these sort of weird bureaucratic processes have been difficult. There has been a lack of focus on early interventions, even though that was part of the original goal. And then there's been concerns about sustainability of the scheme with growing numbers of participants and costs. And there's multiple reasons for that. Now, concerns about market failures and sustainability have brought about renewed attention to the value of informal community supports. And when the NDIS was first established, it was meant to be a 3-tiered system. And you can drop the next slide up for me, please, Max. And I'm just going to take a drink of water. So the 3-tiered system had 3 tiers. The first was universal supports, which was to focus on creating inclusive and accessible communities for everyone. So this tier was meant to supplement individual funding by focusing on improving the overall community infrastructure and public services to ensure that the society that we live in as a whole was disability friendly. And this included ensuring that public spaces are accessible, promoting awareness and education about disabilities, and supporting communities to be inclusive. The second tier was information linkages and capacity building, which was aimed at providing information and referrals, linking people with disability to support services, and building the capacity of communities and individuals. And this tier was meant to help those who weren't eligible for individualised funding under the third tier, but still needed assistance to connect with necessary services and supports. And then the third tier was the one which we're all familiar with, which is the individualised support that's targeted at individuals with permanent and significant disability who require long-term support. Well, in practice, the NDIS came to focus almost exclusively on tier 3, largely ignoring tiers 1 and 2. A tiny portion of funds were allocated to ILC grants in tier 2. I think in 2019, it was something like $100 million when the scheme was worth, 23 billion or something like that. So this tiny portion was allocated to that. But largely it wasn't developed in any systematic or coherent way, and essentially got ignored with just the focus on individual packages. And it's certainly the case that state and territory governments seemed to decide during the during the decade of the establishment of the NDIS that the problem, and I'm using that word in quotation marks, the problem of disability was now in the hand of Commonwealth, and they didn't need to worry about it anymore. And so they really took their eyes off the development of community-based informal disability supports. And far from improving their situation, as a result, many people with disability found themselves worse off. There are, in case you weren't aware, about 4.4 million Australian people with disability in Australia, and only 610,000 of them are eligible to the NDIS. And this whole situation got worse because as the NDIS became the only lifeboat in the ocean, it's sometimes called, or the only oasis in the desert, in other words, the only place to obtain disability support, people understandably were desperate to access its funds, and as a result, the number of people on the scheme has greatly exceeded expectations, and the costs have been more than the Productivity Commission estimated. This has led, unfortunately, to the recent politicisation of the NDIS and its targeting from conservative press, Sky News and the Financial Review, other right-wing politicians, which have tended to frame the scheme as a form of welfare and participants as welfare cheats. And it's been pretty unfortunate. As we started by saying, it isn't a welfare scheme, it's an insurance scheme designed to protect every Australian at risk of disability, which is every one of us. And most of the participants who use it do so to access reasonable and necessary supports. So the politicisation has been really hard to watch. So the recent NDIS review proposed abolishing the three-tiered system and replacing it with a simplified two-part system. And you can put that onto the next slide for us, I think, Max. So the two-part system has individual supports, in other words, the current tier 3 supports, which is targeted for people with permanent disability needs. And then the second is likely to be foundational supports, which are the responsibility of Commonwealth, state and territory governments, in other words, everyone, not just the Commonwealth, which would benefit all people with disability, including those without an NDIS package. And foundational supports, you can go to the next slide, might include a whole heap of things such as information and advice, individual family capacity building, peer support, advocacy, attitudinal change programs, disability employment supports, early childhood supports, psychological supports, transition supports for young people, etc. There's a lot that goes into this. And I think the other panelists are probably going to talk to different parts of this, but let me just comment on one or two before I open up the conversation to our colleagues. Because I've got just a connection with a few of them. And the first, I guess, is peer support, which for me is a critical service that is often not funded in individual packages. I first encountered peer support in the rehab setting at Prince Wales Hospital, where for most of the day, I was surrounded by non-disabled health professionals who gave great service, but the people who really showed me how to live with disability were the peer support workers from Spinal Cord Injury Australia. A few years later, I joined the board of SCIA, as Brendan mentioned at the start, and the main reason for doing so was to support and promote peer support work. And it was only when I was on the board that I realised that no one funds this peer support work program, and the peer support is entirely funded by donations, and it's always on the edge of being closed. And it's really interesting because I think peer support is so vital to people first encountering disability and who live with it over the long run. And the peer support workforce is really advanced in the mental health sector, but much less so in the disability sector. And it's an area in which we can greatly increase our work. I think it involves both paid and non-paid people, if we think about it carefully, that balance between a paid workforce and people who are willing to give and able to give their time. So I think that's a critical area to look at. I think one of the things that became apparent when I was involved with the work of the Royal Commission is that violence, abuse, neglect, and exploitation is driven by negative attitudes to people with disability. And one of the reasons people with disabilities struggle to be included in the general society is because ableism is prevalent. I think I've got a slide there with a definition of ableism for you, Max, but ableism, um, informally, it's just another word for, a similar sort of word to racism or sexism, etc., but it's a more subtle sort of word. Ableism is a trajectory of perfection, an assumed and often unacknowledged vision of normal bodies against which disability is a diminished state of being human. Ableism dehumanizes people. It involves attitudes and behaviors that shape people with disability as different to, less than, or inferior to people without disability, incapable of choosing their own path, and an economic and social burden. Ableism, for example, has driven the segregation of people with disability into special schools. It's framed the underemployment of people with disability, the assumption that we're incapable of working effectively and efficiently, a burden in the workforce, leads to low levels of employment. I think on the next screen, I've got a little bit of information there about employment. But only 48% of adults with disability are employed compared to 80% of people without disability. And certainly it's a major area of focus that we need to pay attention to. I've been involved with a couple of projects that's been looking, for example, the Achieve Foundation's Disability Employment Catalyst has been looking to increase the numbers of people with disability working in the disability service sector, based on the principle, nothing about us without us. And yet the disability service sector is extremely low in its employment of people with disability. But obviously, it's the wider community that we need to pay attention to as well, where rates of disability employment are low. If people with disability represent 20% of the population, then we should encounter people with disability in all of our workforces. And there's various barriers preventing that from occurring. I should add that universities can and should be leaders in the disability employment space, but often we're not. Even those fields whose work focuses on disability, such as medicine and health sciences, tend to be biased against disabled teachers and students. I have a friend who oversees the student disability plans in the Faculty of Medicine and Health at a major university. You can guess which one that might be. She regularly encounters reluctance amongst staff to allow disabled students to utilise reasonable accommodations and supports that would be standard practice in other degree programs. And the concerns she hears typically stem from fixed views on inherent requirements, normative assumptions about what a health professional should be able to do and how they should do it, fears about safety risks, and concerns about workload resource implications. And all of these rationales, when you hear them, are essentially ableist tropes about people with disability. And there are very few lived experience faculty members in permanent and full-time roles in our universities. We're mostly guest lecturers in programs led by non-disabled people. But imagine what a difference lived experience teachers and programs could make in the classroom, modelling disabled insight and strength to disabled and non-disabled students alike, and teaching disabled perspectives and theories, modelling what a workforce could be like so that when students come out of the university, they expect to see that in the broader community. Look, there's so much more to say, but I want to open up the floor. I think we also need to implement a much more inclusive local communities. The NDIS has sometimes been criticised for developing what's called paid friendships, where support workers have operated as friends for people with disability. I've got a son who's studying psychology, just finished his 5 years psychology, and during that time he was a support worker. And it was really interesting to watch the process because although he heard the criticism of paid support work, he said actually he was able to involved in getting people out and about in the community who weren't doing so before. So I think there is a real role for tier 3 support workers to help people get out and about, but that can only be effective in the long run if the communities in which we're taking people to are welcoming and inclusive. If there's somewhere to take people that that is accessible and open and inviting, where people feel like they belong. And so the relationship between the sort of that individualized support in the NDIS and these informal supports needs to be strengthened and work together rather than seeing these as separated and isolated programs. And I think I've said enough, Brendan.
Okay.
So hopefully that's given us some context and can
That's
open
great,
the
Shane.